Okay, so I'm going to cut the Coban. The Coban is to help with the edema in your hands, the swelling. So I'm going to cut it about like a ruler's length, and some of your fingers, if they're longer or swollen, you have to cut a little longer. So we're going to cut it for each of your fingers. So you're wrapping right at the top and wrapping it halfway around each time. I'm not going to pull it tight to where it turns white, but it's not loose either where it's like that. So it's just snug around there, and we're just going to pull it and wrap it halfway around each time to the base of your hand. And the Coban sticks to itself, so it'll stick to itself just like that. And then when you're starting with the fingers, the same thing. If you can hold your finger up. Sometimes I like to kind of cross over in the middle like that. It helps it stay on a little bit better. And then again, I'm not wrapping it tight. So it's just tug. And then you can use your other finger to help place it around. So you are pulling a little bit, but when you place it, it still loosens it up where it's not tight. And then after you wrap the fingers, then you can check for capillary refill. So how you do that is you're going to press down on your hand, and you see how it turns white, and then the color comes right back. If it takes more than 3 seconds, then the Coban is on too tight, or if the patient can tell you, my hand's tingling or numb, then it's on too tight. And the most important thing with Coban too is if they have a dressing on, you want to make sure that every area that you're putting Coban on, if it's a burn, has a dressing over it. So if it's burned and it doesn't have a dressing on it, then you want to add a dressing because it'll rip that burn. So that's another important thing that we tell them in treatment. And then we use the 2-inch to go on the hand. So we start right at the base of the fingers, and you just want to make sure all these little tails are straight. And I usually pull the Coban when you're pulling it off, pull it this way so that you're not pulling it that way where it's going to be tight. So you start right at the base of the fingers. And again, you're not pulling it tight. And I wrap usually 2 to 3 times between the index finger and the thumb. And you're just holding it right here when you're pulling, and then wrapping so that it's not pulling tight on them. And you're going all the way around, just working to the base of the hand to the wrist. Wrapping it halfway around each time. And you just want to make sure every area is covered, that it is burned. And that's it. And you just cut it off. And then you can check all your fingers again for capillary refill. Make sure that the color's coming right back. And then that's it.
Mhm.
Good job. Good job, hands.